think I will start moving forward with some of our intros and housekeeping as folks keep trickling in. But welcome, my name is Tanya Curiel. I'll be facilitating our session today. You are at the monthly office hour session for HRSN service providers. If you are an HRSN service provider or thinking of becoming one, this session is for you. If that is not you and you just want to listen in, we are happy to have you here as well. We can go to the next slide. All right, a few tips for our session today via Zoom. If you haven't joined us for an office hour session in the past, we use the Q&A function that is at the bottom of your Zoom screen for questions. We'll start the session with a few updates and reminders and then have a big chunk of time for you to ask your questions and get them answered. If you think of any questions as we're going through updates, please put them in the Q&A function chat, and then we will handle them as makes sense. We have our presenters that are also our subject matter experts. So if they are talking, they might not be able to read your question and answer right away. So we appreciate your patience as we do our best to answer all questions. This session is being recorded. I don't know if we've hit that button yet, but it will be recorded and then we post it to our training webpage, and we'll share a link to that later. We also have closed captioning. So if you click the CC button at the bottom of your screen, you can see the closed captioning. And then we have a live interpretation to Spanish. And I'll take this moment to ask folks, if you use the live interpretation, if you wouldn't mind sending me a message in the chat so we can continue to provide live interpretation in the new year. If this is something that is useful to you, please let us know. And as always, if you have any accessibility needs or requests, please let us know as well so we can make sure to provide this session in a format that works best for you. Next slide, please. All right, on to today's agenda. We will get started with welcome and introductions, which we've done, and then go into updates and follow-ups. We will start with updates from OHA on community capacity building funds, and then we'll go into updates and reminders that are more general to the HRSN program. After that, we'll spend most of our time doing a office hours session where you can get your questions answered by our subject matter experts here at the Oregon Health Authority. And then we will wrap things up with our upcoming opportunities. You'll hear about our training plans for 2026. We've sent out those dates already, so you can get them on your calendar. And then we'll share the resources that are available to you as a provider. So with that, we can go to the next slide. Next slide, please. All right, I will hand it over to my colleagues in the CCBF team so they can share information about community capacity building funds.
Great, thank you, Tanya. Good morning, everyone. My name is Lisa Croyce, and I'm the 1115 Senior Policy Advisor. And I'm going to share some information and overview of this year's Community Capacity Funds Grant Program. I also want to introduce my colleague. Actually, Vita, why don't you go ahead and introduce yourself, who's going to be going through the data with us today.
Hi everyone, my name is Vita Achusi, and I am the research analyst that worked with Lisa on the community capacity building funds.
Great, thank you, Vita. So I do want to remind everyone, I think most of you are familiar with the community capacity building funds and the grant program, but I want to make sure to remind everyone about some of the key components. So as a reminder from our waiver, we were authorized to spend up to $119 million on what we call community capacity building funds, and what you'll see in our waiver described as infrastructure funds. It is a CMS term. We felt like this term was more understandable and comprehensible for what it actually provides. So we call it community capacity building funds, or CCBF. Each CCO administers the funds in 2024 and in 2025 through a grant program. Each CCO was allocated a base amount, and then there were additional funds added based on their forecasted membership for the upcoming year. So that's how those allocations were attributed to each CCO. They were required to manage the grant program with a standardized application and budget form, as well as standardized dates across the state so that everyone had the same amount of time to apply. The funding windows were the same for all organizations across the state, and that process for review and approval was on the same timeline across the state. So community partners that would be HRSN providers were eligible for these funds. And again, this year, this was the 2-year program. This year, 2025, was the final year for the grant program. And then I just want to note that there was another 11.9 million in CCBF that has been set aside, and that is through a separate process that the tribe, through the tribal, administered through a different process with the tribes. Next slide. Thank you. So there were some key changes from 2024 in this year. We understood that there were quite a bit of challenges in the housing space this year. So we did an expedited process and allowed 20% of each CCO's allocated amount to be expedited to housing providers. There was 6.3 million across all CCOs that was expedited, and that was in the summer of 2025. We also allowed each CCO up to 20% of their allocated amount to support the provision of HRSN housing benefits. Again, that was as we identified some significant challenges in that space and wanted to provide additional resources. There was 6.9 administered across the state to the CCOs that applied. There were 12 in total that applied. So not all CCOs applied for those funds. All CCOs, aside from Pacific Source Lane, which we will talk about towards the end of this presentation, were required to notify their grantees by 10/15. So at this point, all organizations that were awarded funds should be aware of that and hopefully are receiving those funds already or ongoing. And so again, this year is the final year of the program. Next slide. And I'm just going to go through this pretty quickly because I do want to make sure Vita has enough time to go through the interesting data slides. Again, CMS required the funds to be used in certain ways in certain broad categories, which were technology, development of business or operational practices, workforce, or outreach and engagement for HRSN benefit provision. Next slide. And then here's just a quick snapshot and summary of this year. Vita will go through some additional slides that really provide more details about how the funds were allocated in those broad categories and to different HRSN service providers. So for 2025, over 45 million was awarded to 120 CBOs. About 6.9, as I said previously, was awarded to CCOs. That's about 12% of all the funds. 40 CBOs received awards from multiple CCOs. 25 CBOs plan to serve as conveners, and this is a new category this year, and we can talk a little bit more about what that term means. 12 CBOs plan to serve as network managers or hubs. Again, that is a new category, and we've got some more details later on in the slides. Overall, CCOs awarded more funding to organizations that provide housing benefits, and most of the funding went to support CBO's workforce. So I'm going to hand it over to Vita for the next few slides to go over some of these key data points.
Thank you, Lisa. Can we have the next slide, please? Okay, so the following analysis that we're presenting today relies on three data sources. The 2025 full application from all CBOs and both the 2025 and 2024 CCO reporting on proposed organizations to award. This year, the CCBF application included both quantitative and qualitative responses about organization type, counties, and population served, language access, provider services, allowable funding use, and budget details. Next slide, please. Okay, as with any analysis, the data isn't perfect, so it's helpful to be aware of its limitations. Here, the main considerations are that many CBOs provide more than one type of benefit and serve more than one population. And the CCBF application didn't really ask to specify how much funding CBOs plan to use for each population or each type of benefit. Because of that, some of the slides you'll see don't show exact funding numbers for every category. Instead, we made some assumptions to estimate how the funding might be distributed. We assumed that if a CBO serves multiple populations or offers multiple types of services, that they spread their grant money equally across them. Um, and these estimates gives us a starting point for understanding funding distribution. Next slide, please. Here we have a visual looking at total funding by allowable use for 2024 CCBF in gray and the 2025 CCBF in purple, and green for CCO CCBF. Workforce continues to receive the largest share of funding, which is about 40 million.
Hello.
Um,
Hello.
oh, I think someone's on. Oh, okay, which is about 40 million. And this is more than 70% of the total CCBF grants allocated in 2025. And we also see a shift in 2025 where outreach received the second largest share. Next slide, please. For funding by HRSN benefit type, the estimates for 2024 in orange and 2025 in blue are quite similar, with housing benefits receiving the largest share of funding. And for 2025, like Lisa mentioned, we also added convener and hub. Next slide, please. This slide also shows the funding by HRSN benefit type, but in percent, with the overall totals on the left and the breakdown for each CCO on the right. As we can see here, housing received the largest share in blue at 36%, followed by outreach and engagement at 31%. Next slide, please. We also looked at each funding by allowable use and estimated the different HRSN benefit types in each category. And we found that housing is the most funded benefit within each allowable use category, as you can see in purple, except for outreach. Next slide, please. For CCO and recipient relationships, CCOs awarded about 26% of funds to CBOs they had no existing relationship with, which is the one that's highlighted in orange. And this was actually similar to the 2024 results, which was also about 26%. And additionally, the grant and contract actually make up the largest share at the bottom at 53%, and this may be due to previous established relationships. Next slide, please. We also did a sub-analysis of organizations that plan to serve as network manager or hub. So if you're an organization and you indicated in your application that you intend to be a network manager or hub. This year, OHA added two new roles, a convener and a hub organization. A hub acts as a network manager, supporting activities like HRSN contracting, implementation, invoicing, and service delivery. And a convener can be an organization that brings HRSN providers together in some way to support HRSN services. In total, 12 unique organizations that plan to serve as network managers or hubs, and almost 5 million was awarded to them. Many of these organizations do provide more than one type of benefit and serve more than one population. Next slide, please. Here we included a table showing a list of the CBOs planning to serve as network manager hubs, and we also included their CCO and the HRSN benefit type they indicated in their application. Most CBOs planning to be network managers or hubs also plan to provide housing benefits, which are both highlighted in orange. Next slide, please. For these 12 CBOs, we estimated funding by HRSN benefit type. The hub category had the largest share of funding of about 1.5 million, highlighted in orange, followed by outreach and engagement, housing, convener, nutrition, and home changes for health. And that's it for some of our results. Next slide, please.
Great, thank you. So just wanted to highlight a couple of the next steps for community capacity building funds. Each year, we conducted a survey. So in 2024, we conducted a survey and did it again in 2025 for organizations that applied so that we could understand what worked well and what did not. And we will come back to this space and share some of those results. As I kind of noted earlier, there was a transition for Lane County, and Pacific Source Lane will no longer, after February of 2020, or beginning in February of 2026, will not be serving members in Lane County. And so because of that, we are transitioning the allocation of those funds to Trillium Southwest, who will be serving members in that space. And so we are continuing to work through that process. So just want to note that. And then I just want to invite everyone to visit the OHA CCBF webpage. There are details for each year of this grant program. It lists out the allocation to each CCO, as well as all the organizations that received funds and received grants for each year. So lots of additional information if you're interested in kind of diving into those details. And that is it. Happy to answer any questions if there's time, or take feedback as well. Thanks.
Lisa, we have a couple questions about the timeline in our Q&A for Lane CCBF funds to be awarded.
Yeah, I'm sorry, I'm not seeing the question, but if it is about timeline, I do not have a specific timeline. We are working to do that as soon as possible, and do acknowledge and understand that's really important for organizations in that service area. So we are working. As soon as we get one, I'm happy to share some exact timelines for that.
Thank you, Lisa, and thank you, Vita.
Hello.
Leah, was that?
Hello.
Oh, go ahead, Kevin.
Kevin Kosick. Hi. I'm sorry. I just saw the chat that said I could speak during this Q&A. I thought I had to be called on.
Oh, was your question related to this, or was it a
Oh,
different
no, it
one?
was related to the CCOs and payment of non-contracted providers.
Do you mind if we wait for your question for
Oh,
our Q&A
absolutely.
portion?
Absolutely.
Thanks, Kevin.
You're welcome.
All right. Anyone have any questions about CCBF or anything that was just covered before we move into a few more updates. We will have time for general questions in a bit. All right. In that case, I think I'm handing it over to Leah.
Yes. Okay. Yeah. Good morning, everyone. My name is Leah Festa, and I work on the OHA HRSN team. I'm going to just take us through a couple program and policy updates. If we could go to the next slide. Kind of keeping with our questions and kind of transitioning into this update section, I did want to provide just a little more information. We got a question about the Lane County CCO transition. And so I wanted to make sure everyone is aware that there is a website that has updates and contact information if you want to get in touch with the CCOs or OHA. And then they are having a provider listening session today from noon to 1. If you have a chance, I know these got scheduled this week, so it's not a lot of heads up, but if you do have a chance to attend and you have any questions or feedback for them, that will be a good place to share. And they'll be explaining more about the process, and Trillium and Pacific Source both attend those and have some presentations as well. So hopefully, if you have a chance and you're in Lane County or want to provide services there, that could be a helpful space. And we can go to the next slide. All right, so we have quite a few slides on our OARs, our Oregon Administrative Rules. And just to recap, for program improvement and in response to some challenges accessing services, OHA made updates to rules that govern our HRSN program. And these are going to begin January 1st, 2026. These are generally really made to support our members in accessing services more promptly and also reducing some of the operational complexities that were shared. So I will walk through quite a few of these changes we've made just for your general awareness, and I'll highlight a few that may impact you more than others. So to get us started, we clarified that members who change plans, so that might look like changing CCOs, going from open card to a CCO, vice versa, they must be supported in getting the HRSN services that they were authorized for, as long as they are still eligible. So that transition of care piece has been sort of clarified. We updated the HRSN service authorization timeline to align with new federal requirements. So 7 days from the date of complete service request with a 14-day extension option. And then the service delivery timeline doesn't have to be followed when it's impossible to do so, such as when a landlord or utility company may not cooperate or provide timely response in accepting payments. That could be an example. And then we clarified that health plans must make a good faith effort to notify the member of an incomplete request. So the health plan must also help the member get missing information or refer to an HRSN service provider to help. And good faith effort is not easily definable, but could look like a number of things, including contacting the member multiple times over the course of 2 weeks at different times of day, different days. So just really emphasizing that they have tried they're in good faith to contact the member. And then next slide. And I just want to remind everybody, we'll have opportunities for Q&A. And as you're thinking of them, if you want to put them in our Q&A box, we can start addressing those as well. So HRSN program updates continued. We added pantry stocking and fruit and vegetable benefit descriptions and details in preparation for go live that will happen later in 2026. We changed the name of HRSN Climate to Home Changes for Health, defined home modifications or remediations as home changes for safety. We removed the requirement for CCOs to accept OHA's request form or fax. OpenCard will still accept those, but we created it to be optional that they use the specific template that OHA has for a request form, and optional to receive fax for CCOs. And then finally, we added language allowing CCOs to require their HRSN service providers to use technology, such as Community Information Exchange, for HRSN service referrals. So there will be an exceptions requests process. Those are possible if the provider does not have the ability or enough supports to use the technology. But service providers, this could impact you. I think most of you, if you're working with a CCO, are probably already on CIE, but just as an awareness, that will move forward as an allowable requirement. Next slide. Okay, here's some housing specific updates. We have added to rules that it's no longer requiring landlord permission for home remediations if not required by the member's lease agreement. Then we added an exception to rule requiring rental address to match our OHP, Oregon Health Plan address, in circumstance where the member has submitted the address change to the authority. It's OHA. Updated the rule to require lease agreement and income verification for a complete HRSN rent and utility financial assistance request. And that one is kind of new and impactful, so we'll talk about that again. And we modified clinical risk factor criteria for rent and utility financial assistance. And we will go over that in more detail. Okay, next slide, and I will slow down a little. I recognize I'm maybe going a little fast here. So, HRSN housing eligibility update. We, high level, we have our Oregon Health Plan members are eligible if the following applies. Currently housed and renting, and our request, this is new from the rules, must include the member's lease or rental agreement within that initial request. The member must be at risk of houselessness, and this means household income is 30% or less of the region's average median income. And verification at time of initial request is required. This could be a paycheck stub or income taxes. And the member needs support and lack of resources to maintain current housing. Could be another identification of at risk of houselessness. And then there must be a qualifying health condition. So we are going to go through what that now looks like. Okay, there's a lot on this slide, so I'm going to talk through what we mean and the different colors here. So again, these were updated based on feedback during the Rules Advisory Committee and public comment period. So the first 5 on this list in the black font, under 6 years old, pregnant postpartum, young adult with special health care needs, 65 years and older, developmental and intellectual disability. Those are remaining the same. Those will not change. However, as we go down the list, we have modified interpersonal violence experience has now become domestic violence experienced in the past year, which means the member is experiencing domestic violence in their home in the past year or has resulted in child welfare involvement when it is unsafe to provide document or when it's unsafe to provide documentation, self-attestation is applicable for domestic violence, just to note. Then for complex health conditions, this one is now rent and utility specific health condition. And this, there's some more details here. I won't read those, but this requires engagement in the past year with the healthcare system. So that is an updated requirement, and this can include any kind of health provider, including traditional health workers. So that could mean a variety of touch points with the healthcare system. And then we are removing repeated emergency department and crisis encounters and needs assistance with ADLs, IADLs, or eligible for LTSS. These have actually not just gone away, but they've been updated to be more specific in that member may be eligible if they are incapacitated or cannot work for 3 or more days. And those are in our rule as well. I don't know if anyone on our team has anything to add about clinical risk factor. Just open that up. We will go to the next slide. And this, I won't go into much detail here. This really pulls together what we just covered in our last 2 slides into a visual. These will go out in notes, and it can be just a helpful reminder of the eligibility process for rent and utility financial assistance. Okay, now we're kind of hopping to a new topic. I just wanted to acknowledge we've had a lot of questions about billing and utilities, and I know we're probably going to cover a lot of those again today. We are working on releasing updated billing guidance, hopefully this month, that provides more details and scenarios for the 7-day bundling option for O&E and tenancy services. And we are still discussing as a team options for guidance around landlord billed utilities and their date of service, and date of service for utilities billed by service providers. So, we have gotten a lot of feedback on utilities. It's a complex part of the benefit, and we've been really working internally to kind of figure out how we want to address those in guidance. So, just wanted to give you an update. We are working on it. Next slide. Okay, and as a reminder, we are really trying to collect member and provider stories. This is going to help us really help make our case and communicate about our program and the benefits and the impact. And so we'd really appreciate if you have time, either your provider experience or what you've seen with members you've worked with, anything that can kind of help us tell the story of HRSN through provider and member lens. We would appreciate your input. So if you have time, please go online and fill out that form as much as you can. We'd really appreciate that. All right, I'm passing it off. We're ready for questions.
Thanks, Leah. We can go to the next slide, please. All right, we are ready to spend the rest of our time together answering your questions. Thanks to everyone who's already been putting questions in the chat. I know our team has been hard at work answering some of those and gearing us up to answer a few more during this live session. And I know we covered a lot of information in the last half hour. So if your brain is swimming with content, that is okay. We are going to be sending these slides afterwards. And we are also happy to go back to any of these slides if you have a question and you want to ask a question and get clarification on what we covered. So this time is yours. But before we open it up, a few tips and reminders. Let's share the space. There's 100+ people on this call. So if you have 10 questions, maybe don't ask all 10 back to back to back. Give space for other folks to ask their questions. Don't share case specifics. We want to keep this high level and have this be a learning experience for everyone on the call. So if you could keep your questions a bit broader and then not share private information, that would be great. Share suggestions and ideas. You have the HRSN team on this call that is really excited to hear from you and learn from you. So if you have any ideas for how we can improve or make changes to the program, please let us know. And we're going to focus our time on questions from providers and community partners. If you are a CCO, we really value your feedback and comments, but we ask that you help make space for our providers during this session. All right, and logistics. Please add your questions to the Q&A box. Many of you have already found that, but if not, it's at the bottom of your screen. And we will invite you to speak out loud if you have additional questions. However, if you are unable to use the Q&A function or if your question is just better suited to asking out loud, please use the hand raise function and we can answer your question out loud. Now with that, before I open it up to Q&A, I know we had kind of Kevin on the line to ask his question out loud. Kevin, if you still want to ask your
Yeah.
question out loud, now's a great time.
Okay. Thank you so much. So my question is this. I have an office, and we do outreach and engagement and housing support, and I have an office in a pretty high impact zone for homelessness and fentanyl and every kind of crisis you could imagine. So I have a lot of foot traffic that ends up in my office, seeking services, and I don't
Yes.
turn anyone away. But I'm not contracted with Care Oregon, and I'm not contracted with Trillium. I'm just open card. So my question is this. It's my understanding from the OARs that they're still supposed to reimburse for outreach and engagement, even if you're non-contracted. That's what all the OAR language suggests. But I've submitted my claims and I was getting denials from Care Oregon because saying that I was using Z codes, which are not diagnostic, but they are. But they never said anything about not being contracted. But now that I've answered the other question to them about the Z codes being okay to use, now they jump to, oh, well, you're not contracted. So they're denying payment of my outreach and engagement claim, saying I'm not contracted, even though I've actually got some of their members housed and sheltered and, you know, just been servicing their members. So what is this like? It's pretty subjective, I think.
Hi,
Thanks, Kevin.
Thanks.
Yes, Charissa, I'll hand it off to you to answer this.
Yeah, thanks, Tanya. Sorry, I didn't mean to jump in a little soon. Hi, Kevin. Thanks so much. So a couple of things here. I think following up directly with you would be excellent. So we put our HRSN program email in the chat, so feel free to do that. But
Oh,
for outreach and engagement services, well, for all actually covered services for CCOs, contracted providers are necessary. It is necessary to be contracted with the CCO. So it does sound like there are some other concerns and issues you have, though, for clarification. So I think it would be really great if we could chat with you on that. To
yeah.
become an HRSN service provider with the CCO, it is dependent on their process policies and the needs of their community and the region. So there are various requirements for them, but they ultimately have the decision on whether or not to contract and then therefore pay the claims to that HRSN service provider. So I just wanted to provide clarification on that.
Right. My biggest question on that was more or less, it shows that their network adequacy is insufficient because I have Care Oregon clients contacting me on a regular basis that have been approved for HRSN services, rental assistance, and now they're waiting a month because they can't find them a provider. But yet they're telling me I can't be contracted with them because I'm not a licensed provider. So, I'm I'm an open card provider, but I'm not licensed. So it's like they're refusing entry into their network, but they're also depriving members of care because by not allowing someone like me, to join their network, then now I'm essentially not able to serve their clients who are,
I hear you.
yeah.
Yep, I absolutely do. I do think talking about this one-on-one, what organization are you with, by the way? If you don't mind sharing, of
Sure.
course.
It's called the Trauma Drop.
Okay.
Yes.
Okay. That it's just helpful always to have context on that.
Oh, yes.
Um,
Yeah,
Absolutely.
we could
Please
do that more in
email,
an email.
please email us for
Yeah.
some more specific, and we'll do what we can to support you there. I
Thank
saw
you.
that someone else came off mute as
Yeah,
well.
I had a follow-up to his question because I've been in a similar situation where, I had a client who was open card and then they wanted help with their uh, let's just call him their father-in-law. I think it was like their sister's father or something, and he was getting evicted of his house or kind of on the brink of it. And she was like, "Well, can you help him out too?" I found out he had Care Oregon. Obviously, I wasn't contracted with Care Oregon, or I'm not contracted with Care Oregon. And I told us, okay, we can look into that. try to get a contract, trying to get a hold of the CCOs and all type of things, and it was just a headache. And I ultimately ended up getting nowhere. So then I started thinking, like, so my question to follow up with Kevin's is there a route where someone can have their insurance switched from a CCO to be just straight open card, and then that way we can provide service as well? Or once they get on a CCO, there isn't like coming back to open card.
I hear all of that. We'll take some of this, well, not some of this, we'll take all of this back. And then same to you. Please email the HRSN program. We can have a one-on-one discussion about some of these issues you're facing. We would be happy to meet with you soon on that as
Okay,
well.
thank you. I
And
appreciate it.
this
And I'll
feedback and
just add,
information is very helpful for us to do program improvements though. So thank you.
Yeah.
And thank you so much for that last question. And Jessie Wilson, she, her pronouns, 1115 waivers, strategic operations director. I just wanted to address the question around switching plans, health plans. So there is a specific rule that allows for scenarios for members to change their health plans, but it is for very specific continuity of care issues. So it's not applied broadly necessarily just for HRSN. They would have to qualify for that process. So we can add the rule in the chat to clarify.
Yeah, okay, appreciate that. 'Cause I just wanted to know if that was even an option, like to kind of even I'm not gonna say go down and see if it was even a possibility. But I appreciate that.
All right. We started off with good questions. Thank you, Kevin and OPSA, for that. I'm going to move us to questions that are in the chat. I'll start with a question on utility support from Jacqueline, and I'll read it out. It says, when it comes to oil for utility support, our local provider has a 100-gallon minimum for delivery. The total amount for this can be distributed and billed over the course of future months. However, HRSN doesn't pay forward months. My question is, how are other providers utilizing oil through the benefit, and how did OHA plan to support this benefit if we can bill for future months? I don't know if Charissa, that's you, or if we have others who can speak to that question.
Yeah, I don't think that's me. Kathleen, were you able to answer that question? Or Tara?
Yeah, hi. Sorry, I just
Sorry,
had a
thank
little
you.
bit of trouble getting off mute. Hi, folks. My name's Kathleen. I'm with OHA and I use she, her pronouns. Um, in something like this situation where it's prepaying for a large amount of fuel that might last the member several months, we would allow you to bill that amount for 1 month as long as it fits under the UPL. Um, and if it doesn't fit under the UPL, it could potentially be split under 2 months in order to spread that out, as we do allow that for multi-month utility bills. But it is technically something that we would allow to be billed as 1 month, similar to things like prepaid phone, just because that is the expense that member would have incurred within that month.
Thank you, Kathleen. Jacqueline, I hope that answers your question. Tris, I saw you came off mute. Go ahead.
Oh, I'm sorry. We had a follow-up, but it was to a different question. I thought it was to this one, so I apologize. We're fine.
Okay, thanks, Trissa.
Yeah, I actually, just so I understand fully, I had brought this to our provider meetings, as well as a couple other platforms, and I understood that there was not the ability to do that. So if I'm understanding correctly, we can bill as a one-time payment as long as it fits within that monthly cap for that member, correct? Even if it is going to last them, say, 3 or 4 months moving forward.
Yes, just because that is the expense that member would have incurred within that month, similar to like the prepaid phone where they would make the payment all at once. They don't get to split it over multiple payments, so it would be billable within 1 month, and that is definitely something we can add to our billing guidance because I think you point out that that's not explicitly in there, making that clarification. So I think we can definitely get that added.
That would be awesome. Thank you.
Thanks for your help answering that, Kathleen, and for the clarifying questions. I will read off another question from Jennifer about encryption services. And the question is, we are using Unite Us for a referral, but for the day-to-day coordination with landlords, CCOs, and clients, we are looking for a secure email tool to supplement that workflow. Does OHA or anyone in the group have a recommendation for encryption services that integrate well with these external workflows? And I am seeing that I think we're phoning a friend on this one internally. So I might pause on that question and wait for our phone a friend to respond. So I'll pause on that. We'll get back to your encryption question, Jennifer, and I'll read another one in the meantime. This question is about W-9s. How recent does a W-9 need to be? Is it within the last year? Is within the last year acceptable as current?
I can answer this one. The W-9 needs to be current. I would say just for your sake, for the organization's sake, just have a new one completed, because any W-9, unless you've got one for this particular landlord in your organization, just a copy that's been used for other purposes might not be enough.
Thank you. All right, I'll read off another question about documentation. Oops. Sorry, that question disappeared from me right as I was about to read it. Let me go through my question list again. Charissa, is there a question that you wanted to speak to out loud that we haven't yet? All right, Charissa might be typing answers. She's been helping out on the back end. I will read off one question from Jay. Will OHA consider making an exception to the rule of having addresses on the bill for certain phone plans, as long as the name of the client is on the bill, of course? We are running into an issue where clients who are low income are more likely to use certain phone plans that don't provide the same billing statements as larger groups, like Verizon or T-Mobile, and we need to tell them that we cannot cover their phone bill. It's coming across as discriminatory. Any OHA folks have thoughts on this question?
Yeah, I'll take that one. I think the key is connecting that there is some sort of information on the bill that would connect to the member. So if it's not the address and their name is there, yes, we can take that one back and see how to best address that in our guidance and rules. So it sounds like the name's there, so you have the verification that you need. Yeah, that sounds fair. Any other follow-up on that?
I guess my question is then, are you saying that we can cover those? Because like I know in the OARs it says that there needs to be an address, but if there is a name on it, is that allowable, or are you gonna like review it and then give us an answer?
In the rule, we certainly say address, but yeah, the name should suffice. But I want to make sure that we can adequately cover our bases on what we need to address in rule and guidance. So the answer is yes, that should work. But let's take a look, internal team, at what resources we need to update to make sure this is clear.
Thank you so much.
Thanks for the question, Jay, and for your help answering, Jesse.
Well,
All
and
right.
I want to add some clarification here. I think we do need to make sure, I think in the cases of like the phone bill, that makes total sense that there would not be an address. But in terms of other utilities, we need to make sure that they are not necessarily used for a previous address, because the rent and utility benefit is specifically designed for the individual's current residence. So want to just do some checking there to make sure that we don't inadvertently, make that confusion. So I think with the example you shared, it makes sense that there wouldn't be an address. Then does that make sense for folks? The difference?
Makes sense to me, and fund plans are the only issue where we've seen this come up.
Okay. Thanks for bringing that up. That's really helpful.
All right, there is a little bit of a tech snafu happening, so apologies. If you asked a question and we marked it as answer live and we did not in fact answer it live, if you wouldn't mind retyping your question for us. I see a few of you have done that already. So sorry this is happening. I'm not sure what's going on, but we are not dismissing your question on purpose. It's technology. All right, I will read off a couple of those. One of them is from Nicole. What type of documentation is needed to qualify for a claim, especially for domestic violence? Can a promissory letter be issued to avoid eviction and late fees? And I think Charissa's having some tech issues right now. So, Tara, I see that you unmuted or Jesse.
Yeah,
Go ahead.
unmuted and then it just popped me back on mute. Can you please repeat each?
Yes.
There's two parts to that question, is what I think I'm hearing. And if you could give me one at a time, then I can
Let's
answer.
do that.
Thank you.
Part one, what type of documentation is needed to qualify for a claim, especially for domestic violence?
Oh, as far as documentation of clinical risk is what this is sounding like. Documentation of clinical risk should be able to be, the CCO should be able to document clinical risk because it requires some current connection to care providers. For domestic violence, a self-attestation can still be okay with that. We cannot ask people to prove domestic violence.
So in the rules, thanks, Tara, just to add on to that so folks know where there's going to be additional information. In the rules that will be effective January 1st of 2026, there are some examples of where this may be documented, but member self-attestation is certainly allowable, particularly because it could be unsafe to provide documentation, but there are other options as well, such as paid leave, Oregon safe leave verification form, and then a variety of other documents that will be listed in rule, but self-attestation is allowable.
Okay, great. Thank you both. And I'll read the second part of that. Can a promissory letter be issued to avoid eviction and late fees?
And I can answer this definitely, but it depends. So until the member has been authorized for payment, a promissory note would not be appropriate because we can't promise to pay things that are not authorized already. And once the authorization is made, payment should hopefully be following very quickly. And then if the provider would like to write provide a promissory note at that point, that's up to the provider. Once the authorization has been completed and payment is going to be forthcoming though.
Okay, great. Thank you so much. All right, another question that I think we missed the first time it was submitted. Apologies for that. This is a follow-up on a utility bill question. So the question is, it is our organization's understanding that if there is a $350 credit on a client's account, meaning the client does not owe anything, then the new charge amount of $89 would be applied to that prior credit, and there would still be a zero balance due, so nothing for HRSN to pay. This is different from rent, so should we be applying this interpretation differently for utilities? Any clarification we can give on that, please?
So that it sounds like the person has already received some energy assistance, and they do not currently have a utility bill due. Then they would not be getting, that would be duplicative benefits in that case. So if there is no utility bill due, then there's no need for the utility payment, and it would not be appropriate in that month. If the assistance runs out while rent is still being provided through HRSN, then it could be. I mean, it doesn't mean that bill can never be paid, just not while there is no balance.
Thank you. And Bree, does that answer your question? Okay, see a thumbs up. Feel free to speak up or add more to the chat if you need more clarification. And I see there's a hand up from Allie. Allie, feel free to go off mute to ask your question.
Hi, thank you. That'll be me. I had a quick question. So I know in regards to a Section 8 housing voucher, I know if a client has a Section 8 housing voucher, we're only allowed to pay arrears if they owe arrears. But my question is, if we're also allowed to pay utility arrears, if that person also owes utility arrears and rental arrears, are we also allowed to cover utility arrears for them or just rental arrears?
Yes, utility and rental arrears would be fine.
Thank you.
Thank you. All right. While we're on that topic, I'll read a question from Cynthia. Section 8 recipients are not allowed to receive HRSN benefits for rent because they are already receiving subsidized housing. Does that pertain to all subsidized housing, such as public housing or low-income tax credit units?
Oftentimes, those public housing, the funding sources for those types of settings actually is through Section 8. It's just not as easy to see. So the important thing is to ask, it is not our rule. Let's step back and say that first. Our rule allows braiding. So our housing assistance funds can be braided with other sources of support. So if somebody is in an affordable housing unit that is partially credited, partially funded by like state funds, they may be able to receive HRSN to pay their portion. It's dependent upon the rules of the other program. So it's always important to ask the case manager or the worker from the other program to determine whether or not their rules allow HRSN. So this is a limitation not related to HRSN rules, but to the rules of other sources of funding. Does that make sense?
It does. Thank you so much.
Jacqueline, if your question is a follow-up to this conversation, feel free to chime in.
It is. So in that case, we actually also have folks that have received the HRSN benefit who live in subsidized housing due to the fact that we have communicated with those property managers and they also do allow for other funding that comes from our community-based organization. So we've kind of gone on the route of if they accept other funding from our organization, from say state and federal funds, then we can safely assume that whatever subsidized housing programs they might be a part of would also accept HRSN. Would that be best practice?
So you're working with a local Section 8 office on this. Is that correct?
Yeah, so we've got some just subsidized housing units, like whole full apartment complexes that are low income based on certain situations for folks, and they are not necessarily receiving Section 8 as far as like 30% of their income is being allotted for rent, but they're still part of those housing units. And so when the property manager does say that they can receive other funding, we've kind of gone with their word on that, that they are allowed to receive other funding, and often those folks have received funding from us to supplement their rent in the past as well.
As long as it's being accepted by that organization, then it should be okay. The risk is to the member, and if we're wrong, if we fund and make payments on someone's rent, and the organization of their primary assistance does not allow it, then we're risking their housing. So that's why it's very important to talk to that other source of funding. But it sounds like you've got that relationship and you've already been making those payments.
Yeah. Yeah, and like I said, they have received payments in the past from other programs from our organization as well, which are state and federally funded.
Yeah, and if it makes you feel more comfortable, just double check with them. Just check in on HRSN in particular. But otherwise, if this has been working, and if you've already asked those questions of the other organization, then you should feel comfortable continuing to make payments.
Okay. We also do implement a landlord agreement that they do sign and say that they are willing to accept funding from our organization as well. So we have that piece.
And in this case, the landlord is also employed by the other funding.
Right.
Yeah, I would say that's pretty safe.
Okay, cool. Thank you.
All right, thanks for the questions. I know there's a couple more questions related to this conversation in the chat, so I'm going to read them. They're from Katrina, and Katrina, if you have anything else you'd like to add, feel free to speak up. The question is, I would like more clarification about Section 8 housing vouchers. I heard that clients may only receive 1 month of arrears instead of all rent arrears. Can I get more clarification? And there's a second comment. Then maybe I'll wait to let you speak to this one first, Tara.
Sure. Just like with any other member who receives HRSN rent assistance, if a member who is participating in a Section 8 program has rental arrears, they might be eligible for up to 6 months. If they don't have 6 months of arrears, then they wouldn't be. But if they have 6 months of arrears, there's no reason that they couldn't receive the 6 months if they are eligible, even if they're getting the Section 8 voucher. So it's not just limited to 1 month, it's limited to up to 6 months and based on the need.
Thanks, Tara. Go ahead, Katrina.
Thank you for that information. So I recently worked with a client who was 2 months in arrears. And I've worked with some other clients recently who was like more than 1 month in arrears and had a Section 8 voucher. And their housing caseworker said that only 1 month would be approved. And if they received more than 1 month to help out with their arrears, they would be at risk of losing their voucher.
That's concerning and is not what we have been. That doesn't align with the guidance that we've been provided by the statewide HUD office. And is this just a local Section 8 case manager?
Yeah, I was working with a local housing authority and working with their housing caseworker as well as someone else who is a HRSN provider. And I don't mean to call her out, but I see her hand raised. So she might be able to provide some more comments about this.
Okay.
And I know they just had vocalized some possible miscommunication in policies or whatnot, but I'm just wondering if there might need to be some more clarification from HUD.
Well, I think this sounds like a complicated enough question where we may not be able to fully answer here. I think we're going to need to take this one back. And do we want to address the follow-up here, or do we want to go ahead and just take the whole question back?
I'm okay.
Okay.
Yeah.
And I believe we've got our email, the program email is most likely in the chat. And if not, we'll put it in there. And then if you'd like to go ahead and just email any further questions to the program, the HRSN program email box, we can work through it in that way.
Okay, thank you.
Sarah, do you have anything else to add before we take this back?
I don't want to overstep. Katrina, hi, it's good to see you virtually again. I'm the person who was working with Katrina and I work at Salem Housing Authority. I'm happy to get redirection from the team, but to give guidance on what I was offering, this was directly from our local field office and from the memo that Jesse created, I believe in July of 2025 regarding duplication of subsidy. And where we're getting stuck, and I again appreciate guidance from the collective as well, is that according to our PHA and our family obligations to the voucher program, Section 8 participants are required to tell their housing specialist within 10 days if there is a change in income. And then the housing authority readjusts their tenant portion of rent. So the concern that we have is if a client is not reporting a change of income to the housing authority, they're not abiding by the voucher requirements and just defaulting to get another subsidy from another provider is reading as a duplicative subsidy. So the guidance that I had received is the only arrears that should be paid on behalf of a voucher through HRSN funds is the period of time it takes to reevaluate the household income and adjust the tenant rent. We had some breaks in communication when our local field office was unavailable to be reached due to the government shutdown, but we're seeking clarification. But that's kind of where I was coming from. And again, I'm happy to let this go elsewhere. I just want to chime in there.
I don't believe that we limited it to 1 month on our memo, but we will just go ahead and take this back and follow up.
Thanks, everyone. All right, there's a clarifying question on Section 8. I missed the response, but clients on Section 8 don't qualify for rental assistance, question mark?
Well, it's not that they don't qualify, it's that if they received HRSN, it would basically be like a choice at that point. If somebody is receiving assistance through Section 8, then they are considered to be, Section 8 would consider HRSN to be duplicative. So it isn't on the HRSN side that they wouldn't be eligible necessarily. It's just that they cannot, based on their long-term voucher, which is their source of housing stability that goes on far beyond the 6 months of HRSN, they are almost 100% of the time would be better off just continuing to receive that housing, the long-term Section 8 assistance. So if they wanted to give up their Section 8 voucher, they might be eligible for the HRSN 6 months, but that probably is not a good idea.
Thank you. All right, Tara, you're off the hook for a bit. Take a breather. I'm going to read a few other questions. There was a question earlier that we were phoning a friend, and the question was, we're using Unitas for our referrals, but for day-to-day coordination with landlords, CCOs, and clients, we are looking for a secure email tool to supplement that workflow. Does OHA or anyone in the group have a recommendation for an encryption service that integrates well with these external workflows? So this is a question that will point back to everyone else on the call to see if you have any recommendations that your organization is using or any platforms your organization is using for encryption services that are working well for you. We're asking everyone on the call because OHA is vendor neutral and we cannot recommend a specific technology. So if anyone else on this call has technology that you are working with that is working well, we would love to hear from you. I see some folks are putting that in the chat. Thank you. All right, I'm going to answer some other questions and read off other questions, but if you think of any that your organization is using, please add them in the chat. It looks like I keep saying organization. Any encryption services, sorry, that your organization is using, please share so others can learn from you. Um, and then there is a comment from someone about encryption. To make sure that your organization is clarifying the definition of secure and encrypted, because Outlook can encrypt email, but secure email requires a different solution. So I encourage you to work with your organization to make sure that you are using an appropriate encryption platform. Teresa, did you have anything you wanted to add to that?
I do not. Thank you.
Okay.
I just wanted to put it in the chat because I felt like it was a provider discussion versus just a Q&A. So
Cool. Thank you. All right. Let me take a quick look at our questions. And just a reminder for folks to please put questions in the Q&A box. I know some folks are adding things to chat, and it just helps us manage questions if you add them to the Q&A box. One moment. All right. This question is about personal phones. If someone's personal phone is connected to their business account bill for self-employment, would this be an allowable utility, or because it is tied to a business, is it ineligible for payment?
I think the key here is being able to differentiate what's business and what's personal. So if there's a way to do that, then I think that would be acceptable. But it needs to, there needs to be insurance that the business line is not included in any payment.
Okay, thank you, Jesse. Okay, what if the phone is a shared account, like a family plan? Would everyone on the plan need to apply, or can the one person requesting assistance qualify for assistance?
Sorry, I was trying to get off mute. So in terms of, so the rent and utility benefit can be scaled to the household, meaning that whomever is in the Medicaid household can also be included in the benefit. So, for example, if someone is part of, they have dependents part of their Medicaid household who are also on that utility bill, then that can be paid for. It can't pay for someone else's phone line who's not considered part of that household, though.
Great, thank you, Jesse. Okay, and Jesse, it sounded like you maybe wanted to add some context to another question. I'll reread that question about phone plans. The question was, will OHA consider making an exception to the rule of having addresses on the bill for certain phone plans?
Yeah, I wanted to ask a few more questions about that. Just thinking through scenarios where that would come up. Is this, and I wonder if there's a specific vendor and kind of how often this is happening, and if it's because because with most bills, right, there would need to be something mailed to the member, but is this because there's only electronic communication and it's paid solely online? I just wanted to hear a little bit more about that situation. If whoever asked that question has anything to offer.
It looks like Katrina wrote, a lot of prepaid phone plans don't have bills, and it is really difficult for clients to get something that shows their address too.
Are we returning to my question? Is that
Yes.
okay? I was like, I hope I'm not imagining this. But so one of the specific vendors that I know, like not only our organization, but other organizations have had issues with is Cricket, which is, one that is commonly used by folks who are low income. Boost has also had this issue. They don't send out billing statements in the mail. Everything is done online. or over the phone. And it is still like for a month. Like if you don't pay it that month, your phone service gets cut off, kind of thing. So it's not like a quote unquote prepaid phone where you can like buy 180 minutes and then use it whenever. It's like you're buying your service for that month. So and kind of like what I said in my original question, for folks who are low income, which to qualify for this program, you must be low income. These are commonly used plans, and so it does come across as discriminatory towards folks who are like specifically utilizing these services that were like, hey, yeah, we can pay everything else, but we can't pay your phone plan because your address isn't on it. So does that answer your question? Is there more?
It does. Thank you for providing that additional detail.
Yeah.
And I saw some additional comments in the chat. So thank you so much for the additional info.
Katrina, did you have more to add to that?
No, not for this situation.
Okay. Did you have a different question?
Yes, thank you.
Yeah, go ahead.
So I recently am working with a client who has Quantum Fiber as their internet provider, and that is a prepaid service. And it has been very, very difficult to try to problem solve how to pay for the client's prepaid internet bill. And so the only way that you can pay it is through their online account. You cannot call customer service. There's not a automated phone line to make a payment. So you must log into the client's account. You only can pay via debit card, bank account, or credit card. And that information has to be saved on the client's account. And before you can delete that, you have to add a new credit card or a new payment method on the account. So we are luckily able to pay utility bills with our credit card, but obviously our fiscal department did not feel comfortable with us saving that card on the client's account because in order to delete it, a new payment method would have to be saved. And so it took several attempts and tries to figure out how we can pay this client's bill. And what ended up happening is our director paid cash, his own cash, to buy a prepaid reloadable Visa card to then use that to save on the client's account. And our fiscal department will reimburse him later. But it was a huge admin time burden. And so I'm just wanting to share this. I'm not necessarily looking for a response or anything, just share my experience. And I don't know if this information could be discussed later with OHA and just some of the burdens and hiccups that us as providers are experiencing with utilities, because it takes a lot of admin time.
Thanks, Katrina. And I know Charissa jumped on to answer this, but I will flag for time. I'm going to close us out for questions. So this is our last verbal question, and folks who answered and asked questions in the chat, we'll get to your questions. But that will be our cutoff for questions. But, Charissa, go ahead.
Actually, it wasn't this one, but Tara might have more insight.
Okay.
Mine was for a different one.
Sorry.
I do know. I mean, I can respond a little bit. Katrina, we've had these conversations before. We understand it is such a struggle. I know a couple options people have is doing a prepaid debit card and using that number to be connected to the account versus an organization's credit card. But just hearing that, does anybody else want to follow up with Katrina though?
I just want to add that we were able to buy a prepaid credit card, and it had to be a reloadable one. And it couldn't be like a gift card type of thing. But due to restrictions from our company's credit card, we couldn't purchase one of those. So that's where our director took out cash from his own bank account to buy the card for us to then save it on the client's account. And our fiscal department will reimburse him once we get reimbursed from Pacific Source. But it just took several other steps in order to support this client's bill.
Gotcha. I hear that. That's pretty amazing, going to that level of support. So thank you.
And I do have something that possibly might be helpful. With my credit card, I'm able to go online through the portal and request a one-time card number to use for things where I don't want to leave my card number in there long term, or I'm concerned for some reason about using my actual card number. So if your credit card through your employer allows that, it might be, I mean, it still is an additional step to get that temporary card number, but that could be a way to deal with it if it's possible. I don't think it's always possible, but it's maybe worth looking into.
Thank you.
Thanks, Tara. Trissa, did you have a preference for how to tackle the remaining questions? I know you had some on your radar.
Yeah, no, I'll just jump into this one quickly, Tanya. I know we're running out of time. Are individuals permitted to reapply for HRSN assistance upon renewed eligibility? For instance, if the member has recently given birth. We actually received this a couple times, and that's why I'm bringing it up now. And so I wanted to be really clear that there are limitations to each benefit. For instance, the rent and utility financial assistance benefit is once per household over the lifetime of the benefit. But other than that, if they haven't received the benefit before, yes, they can absolutely be screened. Let's say they were denied because they didn't meet clinical risk factor criteria. But in the case of, let's say, becomes pregnant or postpartum, that would be a reason that they may fit into the eligibility criteria. Absolutely, they can reapply and be rescreened. But again, if they have received 6 months of rent, for instance, they cannot receive another 6 months of rent for the lifetime of the benefit. And then the next question, I was hoping Jesse wouldn't mind answering out loud. I think a lot of people are very curious about this. Is OHP tracking how much money is being spent on HRSN? I can answer that yes, we definitely are and have reporting on that. But there was some additional nuance here. The rest of the question states, I'm curious if we're doing a good job of getting money out the door to members that need it. Since my understanding that this is 100% federally funded, are we on track to spend most or all of the total amount allowed for HRSN during the waiver period?
Yeah, so we are tracking utilization and spending. We use claims data for that, and there is a bit of a claims lag in what our systems currently show versus how much it has been spent. And so we'll be looking to at the end of this year, kind of wrapping up the year to date or the housing spend from November 1st of 2024 through November of 2025, being able to have that claims data by the end of this year and looking to share some information in early 2026. In terms of the funding, Oregon does have to provide a matching rate for this. So it's not solely federal. There are state matching funds that are provided through HRSN. We do have a higher match rate through our HRSN program, which is great, but there is a state obligation there. I don't know if I answered all the questions, but essentially more information to come when we have that updated claims data that we'll be able to share out publicly. And I see we do have a hand up.
Yes, that'll be me. Hi. A quick other question from my end here. And this is, I think OHA will be the best to answer this question. What do we do with people who have already received the 6 months, but they come back and apply like under their child's name or like spouse name? Because my understanding is there's only allowed one person per household to receive HRSN. But what do we do if we run into these type of people? Do we take them, or do we say that you received the help in the past? Yeah.
Yeah, great question. I think if you know that they have received that assistance at the household level, letting them know that they would not be eligible, but eligibility determinations are made by the health plans though. So the CCO or Accentra through Open Card should be making that determination and having a record of that. But yes, you can certainly share that another resource may be more appropriate if someone in their existing household who is part of the Medicaid definition of household has received that benefit, that they would not be eligible. And I did put that in the chat, a couple of rule references there if folks need to better understand the definition of the household that is there.
All right, thank you.
Thank
We
you.
are responding to one final question that's in the chat by text. Chelsea, if you could screen share, please. In our last like 2 or 3 minutes, I'm going to read off a few things. If we wouldn't mind sharing screen. Thank you, Chelsea. All right. 2026 office hours. So the last link that I just posted in the chat is our training webpage. All of the dates for 2026 office hours are live. Most of them are on the second Wednesday of the month from 8:30 to 10 a.m. In last month's session, you told us that you wanted morning meetings, so you get morning meetings. Apologies for anyone that wanted an afternoon one. This is how we could get everyone in the same place at the same time. So hopefully you could join us for these sessions. The only ones that aren't on the second Wednesday of the month are the ones that land on a holiday. So the recurrence isn't exact. But next slide, please. And we want your feedback. Let us know how these sessions are going. Your feedback helps make the case for us continuing these sessions. So if you find them valuable, please let us know. And if there's anything that you want different, please also let us know and we'll continue to make adjustments. I put those links in the chat. We want to make the session useful for you in the new year. Next slide, please. And resources. We post the recordings to these sessions on our training webpage, which I put in the chat. And then there's also additional web pages like the provider enrollment web page, our provider service provider web page, a few others that have great resources that we hope are useful to you. And then you can find those all linked from the training page as well. Yes, the link for the survey is in the chat if you scroll up a little bit. So I will re-drop that in the chat for you. Thanks everyone for being here. We'll keep this open for a minute or two more so that you can grab those links from the chat. Otherwise, we'll send out a follow-up email in the next couple of days, probably early next week. But hear from us soon. Thanks for being here. Thanks for the great questions. And I hope you all have a happy end of the year. See you next year. Take care, everyone. Bye.